we're rolling at the end. Just
Hi,
in case.
I'm Bob Schrupp, physical therapist,
Brad Heineck, physical
and
therapist.
together we are the most famous physical therapists on the internet.
Oh, in our opinion, of course,
There's a few
Bob.
creative differences there in filming. Okay, today we're going to talk about hip pain, three most common causes.
Right.
And I think this is a good video, Brad, because a lot of times people come to us and they say they're having hip pain, and a lot of times I don't think it is. They're pointing to the wrong spot.
You know, on the same thing, I get referrals from physicians and they say the patient has hip pain and I find out it's something different, and we'll talk about that as well.
Exactly.
Okay, so first of all, the hip. One of the biggest things that I find is people really don't know where their hip is.
Right.
I'll have people say, my hip hurts, or they're talking up here where the belt line is, and actually the belt line is way up here by the pelvis.
Right.
Okay, and back here, we've got other tissues, and the hip is actually lower than most people think. And when I tell people, I just explained it to someone in the clinic the other day, I said, put your foot down and act like you're squishing out a cigarette butt like Grandma and Grandpa used to do if they were smokers. Put your finger right there, and you're gonna feel this bone bounce back and forth
Moving back and forth,
over your
sure.
finger, and that's the greater trochanter, which is directly connected to the ball of the hip.
Yep.
And that's where the hip is.
Right.
And that's very important for one of the diagnoses that's a common cause.
Sure.
So, but the first thing we're gonna talk about is, now that we know where the hip is arthritis. That is a common cause, and that's why we have hip
Right.
replacements. So, what are some common symptoms, Bob?
Well, one of them is, I think, where the pain itself is at with arthritis. And generally, to me, quite often with people, it tends to be right on the side here, okay? Less often does it go into the groin. I usually think that's something else. And less often does it go down from the back or into the butt. It's right on the side, maybe going down. If it's really bad, it'll go down all the way down to the knee.
Sure.
So,
And with that, one thing that you can kind of, a quick treatment is use a cane in the opposite hand and use it, watch our video on how to use a cane properly, and it's gonna take pressure off the disc and give you pain relief while you walk.
right, so if you're getting relief with the use of the cane, that's one sign that it's a good sign, possibility that there might be some arthritis in that
Right.
hip. The other thing I see, Brad, quite often is just a lack of motion in that hip.
Yeah.
You know, it doesn't, especially the one that I look for, the first one I look at to see if I think someone has arthritis or not, I wanna see how the leg turns this way and how it turns this way.
While in a chair like that?
While in a chair. You're really supposed to try to keep your butt down, but I'm so tall, it doesn't work for me.
Sure.
I don't know, how well does it work on you?
Alright, so we're gonna do this motion.
Yeah.
Yeah.
And with arthritis, the one that really tends to be limited is this one going out here. A lot of times people have no movement that way,
Yeah.
none whatsoever.
Okay.
And that's a good sign that there might be arthritis.
Sure.
They might be limited this way too. They might even be limited going into extension. But the arthritis generally, you know, it's starting to wear down the joint, and it's just not going to move like it should. And the capsule, which is a covering around the hip, tends to start getting tight, and that's
Sure.
why these don't move.
Let's go on to number 2, and one of the second most common cause of hip pain is bursitis.
Right.
Bursitis is typically over the greater trochanter that I referred to before, and it's right there. Typically with bursitis, walking irritates it, so it's similar to, you can get it mixed up with arthritis as well. But with bursitis, if you find that bone right there by doing this and you rub over that, it's gonna be tender.
Yeah, that's one of the signs that it may be a bursa. A bursa is a fluid-filled sac.
Right here.
So it's right over the top of the bone. It helps the muscles glide over the bone.
Right.
Muscles and tendons glide over the
Right.
bone.
And if it's
So-
tender and inflamed, boy, you touch it, it's gonna be hot.
And it's gonna be right on that side. Again, right here, like Brad said, when you're turning, it's not gonna be back here, it's not gonna be in front here, it's right there.
Right. So again, walking irritates it. You can use a cane with this one also, just like
Right.
arthritis, it'll help. Cold packs on that one for sure.
Yeah.
Okay?
Exactly.
And the third reason is you don't have a hip problem at all. It might be a referral pain from a back problem.
Right.
And the pain
Very common.
Yeah. I've had people come in to orders from the doctor to treat the hip. I find out the problem is from their back. I treat the back, hip pain disappears.
I've even seen it go further, Brad, where they've received a cortisone shot in the hip, and it didn't get better, and the reason was it was coming from their back.
Right.
I mean,
Now, that gets a little more complicated to try and diagnose yourself. I think a
Right.
therapist usually can. The only simple thing I can think of for you to do is if you have hip pain and this is very simple, it doesn't conclude anything, but if you have hip pain and you lay on your stomach and you do this, and it changes the pain in your hip, it's probably from your back, because when I do this, my hip is not moving at all, it's just my back. And if I do that and the pain in my hip moves to my back,
Right.
that's saying it may be or likely from your back. Even that's not conclusive, but it's a little quick test.
I
you
think
can do.
just the fact that if you're having back pain, you know, throughout the day, and hip pain, I would definitely think of the back as a possibility there.
Sure,
I mean,
you bet.
they certainly both could be going on at the same
Yeah.
time, but, you know, it's gonna make me think, you know, that's a possibility.
Right.
So, and if you're older, and you've had a fall, there could be, you know, a fracture in the pelvis, which could be giving pain over there.
Right.
There's a lot of other possibilities, obviously,
So
so.
I hope we made it clear as mud.
Yeah, all right.
So keep subscribing to us, because we're gonna give you more helpful hints on why your body hurts and how you can make it feel better. And what do you, just subscribe, are we supposed to slap or something?
Yeah, slap that subscribe button,
Oh, yeah.
man, just slap it. All right, thanks a lot.
Don't wreck your computer doing that.